Welcome back. And the Hindi film industry superstar Shah Rukh Khan's son Aryan Khan is currently at the Killa court, where the NCB is seeking to extend custody in the Mumbai drugs bust case. 5 other people have been arrested, bringing the total number of arrests in the matter to 8. The NCB had raided the luxury cruise ship Cordelia on the night of 2nd October, seizing hard drugs such as cocaine, hashish, LSD and MDMA. Continuing this crackdown, the NCB conducted fresh raids in Navi Mumbai both yesterday and today.
सर, जिस तरह से कल तक गिरफ्तारी 8 लोगों की हुई थी, एक और महत्वपूर्ण खबर मिल रही है कि एक और आरोपी को गिरफ्तार किया गया है। इस मामले में क्या जानकारी है?
जो आरोपी गिरफ्तार पहले से ही हुए थे, उन 8 में से कुछ लीड्स मिले थे, पूछताछ में लीड्स मिले थे, तो उसी की लीड के आधार पर कार्रवाई हुई है। और इस कार्रवाई के तहत एक ऐसे व्यक्ति को अप्रहेंड किया गया, पकड़ा गया, जिसके पास कमर्शियल क्वांटिटी के एमडीएम और अन्य पदार्थ मिले। जो मोबाइल फोन्स या गैजेट सीज हुए हैं, उसमें से भी काफी एविडेंसेस मिल सकते हैं या मिल रहे हैं, जिन पर अभी कार्रवाई जारी है।
इस मामले में कई फिल्म स्टार के बच्चों का नाम आया, जिस तरह से उसका रोल सामने आया है ड्रग्स लेने का या नशा का सामान लेने का।
मैं सिर्फ इतना कह सकता हूं कि इसके तार जहां भी जुड़े होंगे, चाहे वो बॉलीवुड से हों, चाहे वो इंडस्ट्री से हों, चाहे कहीं से भी हों, हम लोग इसके लॉजिकल कंक्लूजन तक जाएंगे।
Moving on here on the NationAt5 to Sanjeevni, our campaign here on Network 18 to spread vaccine awareness. Good news on this front, where we as a country have surpassed the 91 crore mark in total number of vaccinations, and over 64 lakh people have been vaccinated till 5 p.m. today. Of these, over 33 lakh people were administered with the first dose and more than 31 lakh people were fully jabbed. There are over 80,000 sites to get vaccinated across the country currently. Meanwhile, the centre and the manufacturer of Zydus vaccine, ZyCoV-D, are negotiating prices so that the vaccine can be rolled out to the nation possibly by mid-October. The 3-dose needle-free vaccine is currently in the price range of 1,800 to 1,900 rupees per dose. We'll try and go across to Runjun Sharma for more details. There are 3 doses, but each dose has 2 applications on both arms, left and right. And the argument right now, or perhaps the bone of contention, is the cost per dose, which is, say, about 1,800 to 1,900 rupees. And that is prohibitive, or should be made available at a cheaper rate. That's the argument that's being made. There should be a consensus that should be developed. In the meantime, there is an update coming through that the OK for Covaxin is expected sometime in towards the end of October, early November. But we'll have to see whether or not that fructifies. It's procedural and not judgmental, is what Soumya Swaminathan of WHO has said, CNBC TV 18, while speaking to us here on the network. But going back to ZyCoV-D, Runjun Sharma with us on the phone line. Yes, Runjun, so it's the price at which it will be available, which is currently the issue or contention between the manufacturer and the government.
Yes, Anand, but what we've been given to understand from our sources within the government is that by this week, the government will reach a consensus as far as the pricing of Zydus Cadilah's vaccine, ZyCoV-D, is concerned. Yes, pricing has been an issue. For now, manufacturers have quoted a figure of 1,800 to 1,900 per dose. Remember, every dose is going to be 2 shots. Having said that, it also has a complex mechanism, a gun and applicator mechanism, which in fact costs over a little over 30,000 rupees. It's reusable, but nonetheless, it is the price of the vaccine will be different than the vaccines which are currently being administered, Covaxin, Covishield, and Sputnik V to a certain extent. It will be on the costlier side, but the government is trying to negotiate with the manufacturers, bring it down. Remember, it's also going to be a 3-dose vaccine. So the government, all the more reason why the government wants the price to be brought down. Then the conversations with the negotiations with the manufacturers are on, and this week, hopefully a consensus will come, and the vaccine ZyCoV-D, which also will be administered in adolescents, will in fact be introduced in the inoculation process. Anand.
Well, thank you for your inputs, Runjun. Now, a short excerpt from the conversation that WHO Chief Scientist Dr. Soumya Swaminathan had with Network 18, and here's what she has to say about Covaxin's international approval.
If you can explain to us what have been some of the questions that the WHO has asked of the company.
This vaccine, Covaxin, has an adjuvant that's been used for the first time, I believe, in a vaccine. So when there's a novelty, a novel product, there is all the more care. It's a procedural thing. It's not a judgmental thing about, one vaccine taking than the other. It depends on how much information was provided, how many further questions the experts have. And we go through exactly the same process for all vaccines that are submitted for emergency use listing.
It's a matter of procedure, but the approval should come soon. We're all looking forward to that. In the meantime, are sanitizers harmful? Do vaccines modify your DNA? Can they infect you with COVID-19? Are these some of the questions on your mind? Now there is a space where all these queries or all such queries can be answered. As part of Network 18 and Federal Bank's campaign Sanjeevani, a WhatsApp helpline has been launched. All you have to do is WhatsApp on the number 7977773753 and you will promptly receive your answers. Information that has been verified and cross-checked. So go ahead, WhatsApp your questions on COVID-19 and get all the information you need. The number is 7977773753.
आपने टीका लगाया क्या?
टीका लगा, वो जरा टीका लगा। जब अपनी बारी आए टीका लगा। टीका लगा, वो जरा टीका लगा। जब अपनी बारी आए टीका लगा। टीका लगा, वो जरा टीका लगा। वो जरा टीका 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 टीका
लगाया क्या?
लगवा ले जुबान जरा सहले सहले तू सबसे ये कह ले है जनहित में जारी मिलती का डरना ओ निडर टीका लगा वो जरा टीका लगा जब अपनी बारी आए टीका लगा वो जरा टीका लगा वो जरा टीका 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 टीका
लगाया क्या?
टीका लगा वो जरा टीका लगा जब अपनी बारी आए टीका लगा।
And India's retaliatory norms to combat the United Kingdom's discriminatory travel rules have kicked off from today. India will impose a 10-day mandatory quarantine and COVID-19 tests for all travellers from the United Kingdom from today in a reciprocal move. The British government faced intense backlash over its refusal to recognise India's COVID vaccine certificate.
At the practical level of travel, nothing really changes as of today. Before today, passengers arriving in Britain from India had to quarantine for 10 days. They will continue to do so now. What has changed is that they will now fly under clouds of discrimination. As of today, the UK has given permission to people from a number of countries to arrive in Britain without having to go through any quarantine. And that is when they have had the same vaccine, AstraZeneca, as in India. The UK recognizes that AstraZeneca is Covishield, but it does not recognize that the Covishield certification is acceptable. This really challenges and denies the credibility of the Indian government in the entire certification process. This certainly is going to have knock-on effects, and these will be political and economic. For a start, this month Prime Minister Boris Johnson was due to visit India, and he still may do so. Whether he has to go through 10 days of quarantine is another matter. But in any case, even making an exception for him is going to bring its own awkwardness. Again, this month we have very critical trade talks due between India and the UK. A lot of defense exercises that will be conducted jointly are coming up. The focus on defense, and that focus on defense follows the UK's emphasis on the Indo-Pacific region, is of prime importance now to both countries.
But the pandemic doesn't seem to shadow the homecoming week excitement in USA's Nevada County. High school parties are being planned. But what about pandemic precautions? CNN's Jacqueline Schultz has more on this.
Oh, prom, spring fling, winter formal. It was lights out for all these iconic high school benchmarks for most kids during the pandemic. This year, homecoming for Shadow Ridge High is making a comeback, but with some pandemic precautions. Teens will cut loose and literally kick off their Sunday shoes on the brand new football field. Sure enough, on the Shadow Ridge website, the dress code says no heels.
I take them off anyway. Yeah. We can't wear shoes, so they're giving us socks.
I'm not excited about that.
You're not excited, no?
It hurts, so it hurts.
We'll keep social distancing.
Walking around with the mask off is the nicest thing ever.
Aw, so cute!
We caught up with the cool kids as they got to cross off the other item on the high school bucket list. Parents taking lots of pretty photos outside right before the party.
The kids get to be a little bit more relaxed and be themselves. They get a homecoming period. My oldest graduated 2020. That was rough.
Parents say no masks, social distancing, but a dirt dance floor is the best trade-off families and teens could hope for. Just think of it as a modern-day sock hop.
It's totally worth not having to wear shoes. Exactly. No shoes is close to normal, right? Excited that we have it and that we can have like a high school experience.
Sources are telling Network 18 that there appears to be an agreement between protesting farmers in Lakhimpur Kheri and the administration there. The terms of the agreement are a judicial inquiry.
Both sides are agreeing to 45 lakh rupees as compensation, a government job.
कोई भी अपराधी बख्शा नहीं जाएगा, कोई भी दोषी व्यक्ति बख्शा नहीं जाएगा, गिरफ्तारी बहुत जल्द की जाएगी.